Congratulations on getting in. The hard part's done. I thought so. I really thought it was more difficult to get in than being in the program because you have so much support from everybody here. Look around. You guys are gonna be best friends.
You are.
Seriously.
Start a group Skype.
Yeah, you're gonna be good friends, and the people here, Brent and Tom and Don and Bonnie and all of them are wonderful, and they will help you and help you. You're like their kids to them. I'm not kidding. Like, I swear, they're amazing. Hard part's done.
Well, I am Inshirah. When I was in the program, my last name was Grimes, but now it's Robinson. I am one of those people that did the unthinkable and planned a wedding during the program at the same time. So don't do that. I went through the October 2010 cohort. I'm currently an RN at Aurora Baycare in the ICU. I actually got my job offered during capstone, literally after taking the cumulative ATI, and how much fun that was. So you guys have to look forward to that. But it's been great. What else was I supposed to tell you? I don't know. My name, where I'm from.
Yep.
Yeah.
Did you say that?
Yeah, I did.
Okay.
I work in Green Bay, live in Green Bay, and I'm going to answer any questions as soon as Roxy.
Thinking about going back to school?
I am thinking about, that's another thing. I am currently studying for my CCRN, which is Critical Care RN, and I am thinking about going back to school to become a CRNA, which was my goal when I started the program, and the stars just seem to have aligned for me very well through this whole thing because people are always like, oh, you have a 5-year plan, gosh, and you should have a 5-year plan, and it's one of the assignments towards the end, what is your 5-year plan? But my 5-year plan included being in the accelerator program, working for 2 years as an RN in the ICU, and then transitioning to CRNA school. So I am on track right now, not behind, but very close to being about a year behind if I don't kick it up a notch with my studying. But I'll turn the floor over to Roxy and she'll tell you about herself now.
I'm Roxy. I'm from Appleton. I have a relative in the room with me. Her name is Fareen. I graduated in the October of '09 cohort, yes. Live in Appleton. I work in Oshkosh. I work at the prison in Oshkosh. Yes, the male prison. Everybody asked me that, so I just thought I'd get it out of the way. When I graduated, I took a job right out of school at a hospital, and I just realized that it wasn't my thing. And I love correctional nursing. I love it. It's something that you don't think of, or people would never think of being in a prison or working in a prison. And the rewards are much different than what you get in a hospital. They're very similar, but they're also very different. So it's cool. I really like it. It works well with my personality. And what else? Oh, I think Appleton, where my name, cohort, yeah.
Are you thinking about going back to school, or are you content?
I am. I'm thinking about going back. I had always wanted to do the nurse practitioner route, and I never thought teaching would be good for me. And now I really want to teach. So it's kind of like, but I love, like, one thing that I really want to do is teach skills. I really like that. And I really like being in front of people. My first degree is speech communication, so it would kind of work well with me, maybe. I hope. So I'm thinking about doing that. I'm looking into it actually here at Oshkosh, so I can keep the lights on another year here, so we'll see how it works. But, yeah.
Where'd you go for your first undergrad?
Here. Yeah. So.
I just like to give all your money here.
I know. I just like to keep all my money in one basket, paying it to the same place. Yeah.
Any surprises, like anything that happened during your year that you didn't expect, good or bad?
I was just saying I had like a flashback when I was driving over, and you will be surprised, like some things will come like natural. Like you'll study, you'll do your ATIs, you'll listen to your podcast, you'll engage in your group discussions, you'll do all of these things, and they'll become like second nature to you almost. Like you'll feel like, okay, this is the recipe. I'm just gonna do all these things. I'm engaging. I'm learning. I'm talking to other people. I'm really like applying all my skills. But then there'll be some classes and you'll be like, I just don't get it. What happened? Like, where am I missing it? Like, I'm doing all these things, but I'm still not, I'm not acing these tests. I'm not feeling like I'm succeeding in this class. And I remember, I think I called Bonnie maybe like 3 times in this one class, and I was like breaking down. I was like, I don't know what's going on. Like, I don't know what's wrong with me. I'm not getting it. I'm going to get kicked out of the program. And like, you will find that is like your go-to when things are going bad. Oh my God, I'm going to get kicked out of the program. Like, and you'll start to like panic.
And what did I tell you?
You're like, take a breath.
Yeah, she's told me to
Take a
take breaths
breath.
many times.
It will be okay. Like, let's work this out. Like, let's kind of break down what's going on with you, and they will work with you. They will help you out. They are your biggest supporters. Literally, they want to see you succeed. And sometimes in the program, you'll forget that. You'll feel like, man, this is making my life terrible. I want to have a life. I want to go to this wedding. I want to, I want to go on vacation. My friends are doing this. Everybody else has a life. Put your life on hold. Literally, give it a year. Just give it a year. Like, you can literally do anything for a year. You can do this.
Yeah.
You can do this.
I see, and the thing for me, the biggest surprise besides first test, which is really fun for you guys, did you finish it too? What happens is you study and you study and you study and you learn and it's like, it's hard to explain. Like, when you start college, like your undergrad, you start a class, you got to take those 2 weeks to kind of like get your feet wet, see what you really have to read, see what's really important. It's kind of like that over and over and over again, which is good. But one of the surprises that I had was I had more of a life than I thought I would, because you plan. You get to know, okay, I have a wedding in 2 weeks. All right, I'm going to be a week ahead, just so you can go do that. Time management. I was surprised at, if I knew I wanted to go do something or if I had something going on, I could do my stuff at 3 a.m. and it would be done, and then I could go and, go to the barbecue or do whatever I wanted to do. So I was very surprised. I was deathly afraid sitting in your position. Oh my gosh, I'm going to be sitting doing homework 24/7. I'm not going to have a life. I'm not going to be able to talk to anybody on the phone. Nobody's going to know where I am, and it's not like that at all. Honestly,
That was me.
yeah, it's not like that at all, because you get into the swing of things. You understand, you get into your groove. And then once you do, each class is different, but you still, if you're a 3 a.m. poster, you post at 3 a.m., then you check at 6, and then you're done. If you do it at night, it's different. So once you get into your groove, you'll be good.
I can never really work a week ahead, and my husband was like, you need to get out of this house. Like, for real, you really have to, like, close the book. And I'm like, no, I just have one more chapter. Like, I am so good right now. Like, and I, like, kept my coffee pot going, like, 24/7. Like, I was just one of those people I was in my books, like, almost all the time. And he would just, like, you need to, like, find something. And this is my advice. Find one thing that you can do to de-stress. Please find that one thing. Whether it is like yoga or running, or do not lose that. Like, hold on to that during this year. You at some point will need to de-stress. Otherwise, there will be a massive breakdown at some point in time.
You probably have one anyway, but
It'll just be compounded that much more if you don't de-stress along the way occasionally.
that's very true. Yeah, you need time for yourself as well. But like I said, my advice was to work ahead. And I worked, I'm that person that I get an assignment, it's done that day. Or, within 2 days. If it's due within 2 weeks, I get it done. Because it's so weird to say this, but studying and doing homework for me at this point, when I was in this point in my life, was therapeutic. Because I didn't have to worry about it. Like, if I was at the mall or something, I'd be like, oh my gosh, I have to do this test, and this is going on, and I need to memorize this. But when you're doing it, it's kind of like, all right, I'm not stressing out about it, because it's going on. But if you are a week or, whatever, even a day ahead, you don't say you're sick or you feel, you're not feeling well, or like I said, something comes up. You are ahead of the game, you have your stuff done, you don't have to completely be neurotic and worried. Don't get behind. That is the number one thing. I can't stress it enough, do not get behind. You can stay with everything and that's great, but this program is so fast and the reading, you say you have 50 pages a day, you fall back one day, you are behind 2 days because you need to get that reading done and then the next reading done. So, but you'll figure it out. You'll be all right.
What was the most useful studying tool?
I don't know if I had one. I had a couple that I used. For me, when I read, I would read and then I would discuss with someone else on Skype. So I would read and I would discuss, and then I really loved the podcast. I really did. So, putting all those together and then having my PowerPoints and taking notes on the side of those, I was just trying to put everything together. So I think for me, the reading and then discussing with someone and then listening to it again on podcasts really reinforced it for me.
Podcasts, I was different. I did a lot of reaching out to different students that I was in class with because I learn by me explaining something back to you after I learn it. That's how I work. And I found a few other students that did the same. So we would do that and we would talk about it. The podcasts were great for me. They were great. But for me, I get scatterbrained, so if I'm listening to something or it just doesn't, that's not how I learn. I learn by, like I said, talking to somebody, applying it. I'd be in clinicals and I'd be like, oh my God, I just learned this yesterday. It's so awesome. And that actually, you'll see that and that will stick in your brain more than any kind of reading or any kind of highlighting, I think, in my opinion. And then I would talk with my preceptors a lot too, just to kind of get their, you're focused on one thing in that one chapter, but they can give you their broad spectrum of, okay, we're talking about urine output right now. They can tell you what's in the book and what they've learned. So putting a bunch of different information and talking to everybody else, that really, really helped me because you can see it. It's you can see what you're learning and it's so rewarding.
And you'll read about skills, but it'll seem different when you do them.
Oh yeah.
You'll be like, okay, these are the steps. And then when you go to do it, you'll be like, oh wait, this doesn't seem real, I shouldn't be doing this step before this step. And you'll start to create your own process for how you process what you read and then how you're going to apply it. So, it'll say step 1, 2, 3,
Yeah.
and you'll be like, okay, step 1 should really be step 2 because I actually have to do something before that, and step 3 should probably be step 4 following this, and you'll work it out, but it sounds confusing, but when you read it in the book, it'll have it laid out like this, and then when you go to do it, it won't be exactly like it was in the book.
Mm-hmm.
It'll be a little bit different because real life changes things a little bit.
Yeah.
Your patient is not going to lay still.
No. Or they're not going to be really happy with the catheter insertion.
No, they're going to be like, what are you doing? That does not feel good.
Yeah.
And they're going to try and break your sterile field, and you're going to be like, nope, don't.
Book says this.
Don't do it. Don't put your hands down there.
One thing that I struggled with, and I'm sure we're all very go-getter, driven, hardworking people in this room. We have to be to get in and to succeed. And we already have in our lives, but we're here again trying to do something different. And it was very difficult for me because I thought I needed to know everything right away. My first clinical, I thought, oh my gosh, I need to be able to run this code and I need to be able to do all this. You don't need to. You need to, you're gonna learn so much. Even when I graduated, I learned, you pick up so much information. You don't need to know everything right away. If you don't know something, ask. If you have a question or you're unsure of something, they would much rather you or your preceptor, your teachers, your other peers, they would much rather you ask than pretend to know and then not know. And then, you
Do
know,
not pretend to know.
no, they don't want you to pretend. You are more, you sound, some people are afraid, oh my gosh, I'm gonna sound stupid if I ask. You sound much smarter if you ask, because you're not hurting somebody, you're not endangering somebody. And I bet you everybody else in the room or in your, you know, has the same question. So you don't need to know everything all at once.
And a perfect example of that is where I work. If you don't ask, it is dangerous. Like, if I don't ask about this medication, I'm like, am I supposed to be giving this even though this patient, you know, has these contraindications? That is dangerous.
Mm-hmm.
Like, am I supposed to be checking dermatomes every 4 hours on epidural? Yes. Like, just, you know, you should, what were the dermatome levels when you came in? Did you assess those with the nurse prior? Like, you have to ask questions, and it's really important to do such, because these are people's lives, and you won't know everything, and it's guaranteed that you won't know everything.
Never will know
I
everything.
don't know everything now, and I have
Ever.
a ton of questions all the time, and I love my job and the way that it's set up, because we have an intensivist on call or in the building 24 hours. So if I don't know something, if I'm doing blood gases and they come back and they're completely different than the last ones, I will call him, because obviously we're probably going to have some vent changes that are going to happen, one. And two, we may have some medications that we want to give to try to correct some things that are going on with the patient. But I'm going to ask. And then if they're not up or I can't reach them, we have this button on our wall. It's like a red panic button, but it's not. It goes to EICU, and we have cameras set up in each one of our rooms, and they can pan in. And we have intensivists and doctors on the other side of those in Milwaukee that monitor our critical care patients as well. So I can push that button, and they'll pan in, and they'll come through surround sound in the room and ask me what's up. That's what's going on. So I can ask questions to them with that. Like, I had this one neuro patient, and oh my gosh, this is so freaky. He and his father got into a car accident, and I think it was in the winter. Their truck kind of slid off, and they were trying to push it out, and a car came barreling over and hit the truck, and the truck hit the son, and he went flying. And so they were both actually okay, but every time I went to check his pupils, his eyes they just rolled back in his head, like he lost all control of his ocular muscles to keep everything focused. And so I was like, oh, okay, this is weird. Has anyone seen this before? The first resource I had is my charge nurse, because they should know what's going on. She was like, I've never seen this before. And I'm like, okay, this is super freaky. Should I be I paged the doctor. He didn't call me back. I hate when that happens, but he didn't call me back. And then I hit the EIC button and I talked to them about it. They actually had talked to their neurologist, and he was like, okay, yeah, this is probably just because there's more pressure in the brain, and that's a pressure pushing on different things. And we'll put a message through to the doctor. They put a message through, then the doctor called me back, and he was like, okay, it's fine, I'll be in to see him in the morning. But had I not asked that question, and the doctor came in and assessed that patient and saw that, and no one told him about it, that would have been a problem.
That would have been your butt.
That would have been my job, probably. Because our neurosurgeons are pretty, they're interesting people.
Trust your gut. I mean, there's a term, CYA. Always do it. If you feel that something is not right,
It's probably not.
it's probably not. If you're concerned about something, even as a student, you're told, to do something, question it. You're a student, that's why you're there, to learn, and make sure you cover all your bases. And another thing that I learned, humbleness is very awesome. When the preceptors that I've talked to and I've had, is humbleness a word? I don't know, but being humble, they would much rather a student come in and be willing to learn and be willing to take advice and be willing to ask questions than somebody that knows everything. They can't, you're not going to learn if you think you know everything or you act like you know everything, and it might cause issues. And I know that some people have had issues with different preceptors, not in my cohorts or anything, but I've talked to other people. And being humble and being able to ask questions and being appreciative of your preceptors. They're taking their time to help you, and let them know that, you know, you appreciate what they're doing.
Even if it's just a thank you note at the end.
Right.
I gave gifts at the end, but that
So
was
did
just-
I.
Yeah.
I mean-
personalized gifts.
Yeah,
Something-
but I mean, you're with this person for
yeah, a lot of
a
hours.
long time, and they help you. You learn. I still remember things that my preceptor taught me that I didn't learn in books, that I still am like, oh my gosh, you're right. You know, so.
Yeah.
How did that work? We were talking a lot about this, and everyone had just a little bit different take on it. How much work is it to do clinicals and your book work at the same time? Having a class going on, you have to study for tests, and I know that they are on the same topic, but how much more stress is that?
Well, your workload, you're gonna get to the point, because I think the first 3 months or something is all book work, and then you're gonna get to the point and be like, I wanna get out, I wanna do this, I wanna see it, I wanna do it. So it's kind of like a relief, like it's kind of like a relief, like a release of like when you start clinicals, because your book work goes down. I'm not saying you can't spend as much time on it, but you also have a lot more clinical applications and the paperwork that you need to fill out for that too. So it's I think the hardest thing for me to balance out the clinicals and the book work was your clinicals are scheduled. You can do book work whenever, but you have clinicals from, I don't know, 7 to 3. You have to take into consideration that from 7 to 3, you're at clinicals and you can't be doing anything else. So that was the most difficult thing for me.
I didn't think it was more difficult, obviously more time consuming,
Mhm.
but because of where I did my clinicals and where I worked, they were 12-hour shifts. So I would have, you know, my first clinical actually, my preceptor just worked weekends. So that gave me the entire week to get my stuff done. And then over the weekend, I would do my clinicals and I would journal right afterwards. Like, and that's another thing, like when you're doing your journal entries, I would recommend doing them like right after you get off, because everything is really fresh in your brain and your experiences are like that much more vivid and you can explain them a lot more. But I think that it worked out really well for me, and every clinical wasn't like that. Like different people have different schedules, but I think that it was the same amount of stress and the same
think so,
amount
too.
of work, and you do have more time to get your theory workload done.
Coming from a professional workplace and meeting other nurses and from other backgrounds, what are some of the skills and experiences from the program that you value or that you're grateful for having?
In general, I'm grateful for the entire program, because I came from a business standpoint. My first degree was from Loyola University of Chicago, and I had a double concentration in marketing and human resource management. So I had like really not a lot of healthcare going on there. But this program, like, it really primed me very, very well to interact with my peers at work, to have discussions on evidence-based practice, to implement evidence-based practice. And then everyone's experiences are going to be different, but I think it just makes you more well-rounded. In this program, people will sit back in awe of you because you are defying the, you know, you're a machine. Like, you're ready to go. Like, you're a well-oiled machine by the time you're done with this program. You are.
It's a common phrase I hear.
Yeah.
You are. You are. One of the biggest skills, it's more personal and professional. I grew up during this program, and this was something that I put my mind to, that I gained confidence, big time confidence. I remember, I'm sure they remember me just like calling them, being like, oh my gosh, I don't know what I'm doing, oh my gosh, you know, and like, that'll happen, and that's all right, and I learned that. But I definitely gained confidence, and you know, I I don't know if you get this, but when I go, I am proud to say I'm a nurse. And people look at you and they're like, oh my gosh, you're a nurse at a prison? Tell me all about it. Or, or, I see you, the same thing I said to you, God, that'd be so cool. You gain professionalism, you gain confidence, you gain respect, and you learn how to come off and well-rounded, I guess is the best way to put everything. I totally lost my train of thought right now, but yeah, the confidence and be proud of where you're coming from, because you deserve it. You made it in, you are a member of the Accelerated Nursing Program, and you be proud to say that, and you will be, and you should be. And you are, like they said, your preceptors, people that you work with, everything like that, they're gonna be like, oh, come on, how can you really do this program in a year? Really? They're gonna say, you're gonna get it. I'm being completely honest with you. You're gonna get it. And you know what you do? You prove them wrong. You show them how you got in. You show them, why you're qualified, and then they won't be saying that to you anymore.
There will always be doubters, people that
Oh,
doubt
yeah.
you
Mm-hmm.
and second guess. Oh, there's no way that you can do that. Well, you are living and walking proof that there is a way that you can do it. There have been how many cohorts before that have done it, and just be proud of like you said, be proud of where you come from. Like, you do not have a background in nursing, or and you're doing something completely different,
Right.
but you have the capacity to do great things, and know that.
Just think of where just like you, I had no health care. I think I had 2 science classes when I graduated from here the first time. I took 2 years to get all my prereqs, to get into the program, to be a CNA. You have that to be proud of. Hold your head up and be confident in that, and know that you got into a program that is very, very difficult to get into. So you got that on your back already, and then once you start getting in and getting comfortable, you'll realize and you'll feel that you belong, because you do. Sometimes you're going to be scared and you're going to think, oh my gosh, I don't remember this, or I don't know everything, but you need to remember where you've come from, what you're accomplishing, and that you can accomplish the rest of it as well.
That's all you got a question.
I'm curious, you work in a prison just now, and Brent told us he worked in a prison, but you both have very different opinions, or very different experiences. I'm curious, what's the difference?
I don't know. Brent, I don't know.
When I was talking about bidding on I bid on you might not know this, Roxy, but I bid on a project at the prison. I took a 2-year contract on health services for DAC. And it was at a time when my wife was pregnant, and it wasn't that I didn't like the experience, it's that I wasn't really experienced in that area, and probably had no business getting that contract. So when I was talking to you about it, it was more about the context of, wow, I kind of threw myself into this and had to learn along the way. And the one thing about nursing, at least in that context, is that it's a time and place kind of experience. You're able to take your career and adapt to some certain circumstance. I liked what I did at the end because I was really competent after I figured it out, but I wasn't so competent at the beginning. And the one thing you learn in nursing, whether you decide to go to school to be an ICU nurse, or you got this idea you're going to do, every time you go into a new setting, you're a novice. So when I went to nurse practitioners program, I came in all puffed up as this high-functioning ICU nurse to find out I knew nothing about what goes on in the community, or what the resources were, and if I didn't have a good nurse there, I was already up a creek. So I knew drugs and I knew what to do. So it's kind of a context thing. I think you have to go experience those things. If I went back and did it now, and I was doing what Roxy was doing, and I even had an offer to do that as a nurse practitioner, I looked at that and said, well, that'd be kind of fun now because I know what's going on. So what I was talking about I was trying to make an example when I was talking with my group, was that, I sort of jumped into it with underestimating what went on was really what it was, and then finding out that everything's got a huge learning curve. So experience-wise, Roxy, you loved what you did, and you went in a traditional pathway into to work in a prison system. We got more orientation, where I went in and I was supposed to be the expert, and then which was really stupid.
Wow.
So.
So you
anyway,
were
good
at
luck.
DAC?
What's that?
You worked at DAC?
Yeah, I did.
Oh, I just accepted a position at DAC.
Oh, you did, well, we'll talk about that. I had the contract for that for 2 years.
Oh,
So
cool.
I did
Okay.
all the care there.
That's
So-
awesome.
Oh, there you go. We can talk about that and what we need to do.
That is true. But yeah, I guess it was different because I came off brand new nurse. I didn't know anything, you know, and they trained me. I did come from the hospital, and that even my few months there to transition into a prison environment is so hard. You can't open the door, like, you know, when you're at a hospital or when you're doing clinicals, you're gonna take a blood sugar and you're gonna open everything for them and you're gonna do it for them and you're gonna fluff their pillows and you are gonna be the nicest person and bring them coffee. And at the prison, if you open the door for them, it can be considered that you are favoring them, and that was very hard for me. But it's very awesome. It's something a lot of people don't think.
It's a completely unique specialty. So my example was really about underestimating, and at the end, after I had it dialed in, I was like, oh wow, this is a completely different experience. So not good or bad at that point. I liked it in a lot of ways. It's just that the memories of it was me doing something kind of stupid. You know, going and saying, oh, there's a heart in this. Don't do that.
Well, and you're gonna
Don't
find
do that. Do
Do
that.
that.
Well, you know, I mean,
Got it.
you're
That's
gonna
the-
find
that's
too in your clinical. I really thought I wanted to be an OB nurse. I really thought coming into the program that is what I'm going to do. I did OB, and I decided I didn't want to be an OB nurse. And I mean, you're gonna see, you're gonna think, you know, your mind can change in a second, and you like. All the clinical experiences are awesome, and take them all in like a sponge, because you are gonna see what you like and what you don't like, and what, you know, it'll help you and build you to, you know, maybe, like I said, I want to be OB. Don't want to deal with women that are crabby all the time after I got done with OBs. So, you know, like, so I go to the male prison. I guess it makes it better. I don't know. But, yeah, so, I mean, you'll find out what you like. You'll start seeing things like, oh, I really like this about this floor. I really like this about this clinical, and this and this. And then, you know, you don't need to worry about what type of nurse you need to be right now. Because a lot of people are going to be like, oh, what kind of nurse are you going to be? You'd be like, a registered one? So, yeah.
It's fine. I can wait.
Oh, well, go ahead, Brent.
Somewhere along the line, could you talk just a second with them about the need for flexibility?
Oh.
You know, when you're in the program. And you don't have to do that now, but, you know, just
I
hearing
mean,
it from us, it's different hearing it from you.
I think that it, like, you just have to be, not only in the program, but once you start your careers, you have to be really flexible. Like, things aren't always gonna go as planned. Like,
Right.
sometimes things have to change, and you have to be able to be flexible and do different things and have things move around. And you can't always be you can't be like, you know, rigid about it. You have to be like, okay, you know, I'm gonna go with the flow. They have the recipe for success. I'm gonna let them guide me. We're gonna work together. It's okay. Like, I'm gonna have to push this off and do this right now, and everything will be okay at the end of the day. Just don't buck the system. You know what I mean? Don't like fight back. Just go with it.
I said like how I got my, you know, I would wake up at a certain time every day and I would do all my work, but you have to realize that that's not going to happen when you're in clinicals or something like that. So it's the same, but that being said, nursing is also very flexible for you. It's also very rewarding for you. There's many different shifts. There's also many different types. So you give what you get in the same respect.
I was gonna ask, so you both have previous degrees. Do you invoke some of those skills and things you learn? Like you were saying you were marketing. And do you invoke some of those skills in your nursing even though it's completely separate? I could just imagine like there's a certain amount of like sales to
Oh yeah. I'm
Yes.
trying to convince my patient. Yes.
Exactly. Do you find yourself like reaching for those old skills from that previous degree and employing that and you're like, okay, that's really kind of nice that I have that there in my pocket?
I think that the great thing about business is it made me more of like a people person. So I think that it helped me be able to communicate better with people, and like, yes, I do try to convince my patients that, you know, this is our care plan, we'll work together on this, and, you know, I want you to do at least 10 breaths in your IS when you're awake, and I know it's nighttime, and you may not want to do it as much, but neither one of us want you to get pneumonia, so, you know, let's do that IS, let's cough and deep breathe, let's get up and go for a walk. I know it's 4 a.m., but don't you want to get washed up? You might be able to sleep a little bit better if we get you washed up, and I'll change all your linens, give you a nice back rub. We'll be good. You know, we're partners in this together. Like nursing does have a certain amount of sales to it, because you do have to, like, you're dealing with. I mean, if you're on the floor, you could have like 6 patients.
Yeah.
Like, or more. I don't know, when I did clinical, the most that our floor nurses had was 6 patients. But in the ICU, what I like is that I only have like 3, maybe 4 patients at a time. Like, and if I have a vented patient, I'm really only supposed to have 2, because there's a certain amount of monitoring, and there's, you know, ventilator associated pneumonia protocol that we're doing with this patient every 2 hours and returning, and the patient can do nothing for themselves because they're intubated and sedated. So there's a certain amount of dealing with the family at that point, because the patient is knocked out. You know, they're sleeping, we're making them sleep, they're on their vent. But the family, you still have to explain things to them. So there's still like that. It's not. I want to say sales, but it's not. It's just like explaining.
It's educational with
Yeah.
a little bit of sales mixed in there for
Yeah,
good measure.